Welcome to video 1 of 2 for week 3 of Psych474, Arizona State University. I'm Dr. Melanie MacEacheron, and this time we're going to be discussing women offenders. Before we get started, of course, you will need to have read Chapter 5 of your text. I'm going to provide an outline of these slides. We're going to address 3 major points today, and we'll be focusing on where women and men tend to differ when women and men offenders tend to differ from each other. Okay, so first we're going to talk about differences by sex in crime, incarceration, and reoffense. And as a side point, we're going to discuss whether women offenders tend to have different mental health needs than male ones. Second, we're going to talk about diagnosis and assessment. We're going to do a little bit of review talking about risk assessment. And then we're going to talk about clinical diagnosis and assessment, mental health screens, and clinical assessments. Finally, we're going to talk about interventions that have been shown to work well for female offenders. So women cross-culturally have been shown to offend significantly less than men via multiple studies. They comprise about 5% of incarcerees. This is especially so for violent crimes. Women reoffend less. By the way, these citations that I provide here after points, these can be a starting point for you as you start to write your policy analysis papers due October the 4th. So go look these up if this topic is of interest. There's some evidence that mental illnesses are associated with women's criminality. So women in correction systems would seem to be different, and it makes some sense to study them separately, therefore. So what about their mental health? Of course, it's hard to say for either sex, because many times it's only with incarceration that someone receives a mental health assessment. And of course, being incarcerated is stressful and can therefore exacerbate conditions like depression. Women incarcerees, unsurprisingly, report worse mental health than other women, but perhaps surprisingly, they also report worse mental health compared with men incarcerees. Diagnosis and assessment. Most risk assessment instruments have been validated on males. So this may mean that women are either underpredicted or overpredicted to reoffend, and either of those things is not what we want. Some such instruments do have evidence for validity for use on women, and these are 3. The VREG, of course, is review for us, but please do have a look at these other 2, and if you'd like to see a comparison, you can check out this article shown in the bottom corner of your screen. Mental illness paired with either trauma or substance abuse or both has been shown to lead to women's increased criminality. And there's some evidence that mental health issues may pose difficulties in adjustment to imprisonment for women. So for example, in-prison discipline. Assessments are used to either help determine interventions to use or the risk of the offender. Mental health screening. This is the earliest point of clinical assessment in the US and Canada. It's a screen which tells mental health workers whether further assessment is likely needed. Okay, so it's intended to be short so that those who need help can be sent to more intensive, more time-consuming help. Common screens that have been shown applicable to women are listed here, and some of them are briefer than others. One is used on a computer. That's for the case in Canada for any Canadians listening in. And you can compare how good these are depending on your population. Perhaps your population has a lot of illiteracy, for example, and a briefer assessment tool would be better given that they're going to require help and someone is going to have to be present to help them. On to the clinical assessment for some incarcerees. Okay, It's obviously more detailed than the screen. There is a diagnosis created if needed and a treatment plan. Okay, for women, since some diagnoses are more prevalent among incarcerees, the clinical assessment should include psychometric measures for clinical syndromes, okay? Personality disorders like borderline personality disorder. Depression. Of course, depression is more prevalent within women in general. And so among incarcerees, female incarcerees, you would especially want to look for it, as well as anxiety, which tends to be comorbid. Suicide risk factors, always important, especially for people with depression. And actuarial risk measures, again, a bit of a review for us. These simply look at unchanging historical aspects of the incarcerated person, things like their sex and the offense that brings them to you, and looks at previous data from other offenders who had the same profile. What was the risk of reoffense? Interventions. Programs specifically designed based on women's needs are relatively new, but preliminary evidence suggests that these are more effective than ones not designed with particularly only women in mind at reducing female reoffense and substance abuse. What are the best types of programs for female offenders? Here are 3 factors. Substance abuse programs, if they're provided in custody or via therapeutic community-based programs, work better for women. Ones that emphasize offender strengths and skills acquisition and have follow-up in the community after release also seem to work better for women. Here's an interesting project in Canada, which you might want to learn more about. It's called ChildLink. It's basically an opportunity to Skype with children for mothers in prison whose children can't come to visiting times. Here's a brief review. Our first topic, crime, incarceration, and reoffense by sex. Women in correctional system would seem to be different. There's fewer, they're less violent, reoffend less, and maybe more often mental illness associated on average. Our second topic, diagnosis and assessment. Some risk assessment instruments and mental health screens have been validated on women offenders. Mental illness paired with either trauma or substance abuse or both have been shown to lead to increased women's criminality. And clinical assessments for women are suggested to include psychometric measures of clinical syndromes, depression, anxiety, suicide risk factors, and actuarial risk measures. And finally, regarding interventions, programs specifically designed based on women's needs may work better to reduce reoffending and substance abuse if the substance abuse programs are provided in custody or via therapeutic community-based programs. They emphasize offender strengths and skills acquisitions, and they have follow-up in the community after release. And for some free extra reading available via Google Books, you can look for a theoretical basis for some sex differences in violent crime commission from this volume. Please note infanticide is a crime, an historical crime in England and in Canada. And some information from an individual including an individual from Texas, relatively near to you geographically, a female serial killer and female serial killers in general and how they differ from males. And this again might be an interesting topic for your policy analysis paper. And that's the information you would need to access it via your student library login. Next step, complete discussion 5. Send me any questions via email, Blackboard message, or use either of these to arrange an office hour. Thank you.